Hello, my name is Ian Hodge, and I will be discussing my topic, which is poverty in healthcare. This, if you're wondering, is my microphone, because my microphone on my computer has not been working. Okay, I chose this topic because I am from Kansas City. I have been living in the area, um, and it's kind of stuck out to me just how some areas of Kansas City are so nice, and some have just, throughout the years, even before my lifetime, have just stayed a low income and impoverished area. Um, which has really become an issue more and more as the poverty rate's been rising in Kansas City over the past 10 years. Um, in my paper, I address the contributing factors to um, poverty and how that how low income and how what affects poverty affects health. Um, there are several current solutions in place, while most of them are long-term options. Um, they don't have as they have results, but they're kind of slower and they don't really help those who are in need of assistance now. Um, my proposed solutions, which I'll get into later, involves preventative care and as well as the school, using the schools and the school nurses. So as for poverty in Kansas City, it's been getting higher, especially in the urban core areas. Um, the current poverty rate, according to the Kansas City Public Health Department, is 17.58%. And it's even, like I said, it's even greater in other core areas that aren't even covered by the Kansas City Public Health Department. What it contributes to these high poverty rates are several socioeconomic factors or social determinants of health, which are things like living condition, education, access to healthcare, um, environment, your mental health, stuff like that. So, for example, the living conditions, if someone's born in a low income area or if they're born in a family who doesn't have access to good food or to healthcare, then they're more likely to have low health. Uh, Kids who are born or those who live in areas that have issues with education where they don't have access to education or they don't receive the education they need or they're not able to even go to school. Um, Education is a high correlation of health. Those who are able to go to school, and sometimes people who go to school, the only meals they eat are when they get fed from school. So that's important. Those who live in low income areas often aren't in their education often has an impact on that. Those in low income areas who live maybe a high violence area, I mean, it's going to affect their health and also how long they live. For example, according to the Kansas Public Health Department, the death by homicide rate for those 5 years or younger is 5%. For those 5 to 14 years is 16%. For those 15 to 24 is 51%, which I find that to be extremely alarming, is that the death by homicide rate for 15 to 24-year-old is 51%. For those for 25 to 34, it's 33%. 35 to 44, 17%. And those rates, while they're highly alarming, they also contribute in different ways, such as individuals don't feel comfortable participating in healthy living practices such as exercising or going out to the store or walking or just playing outside, stuff that kids normally do, that adults normally do to stay healthy, and that has a huge impact on their health. Another factor is economic opportunity. For example, those who live in poverty have a lower access to jobs that they might lack. They usually lack employment or employment opportunities because of the area they live in. That most businesses aren't going to want to be in that area. The mean income for a solo household, according to the Kansas City Public Health Department, is $11,770, and that has a huge effect on how they're able to afford healthcare. It also has a huge mental toll. Those living in low-income areas, according to according to the Kansas City Public Health Department, those aged 15 to 34 years old, um, of those who die, 19% is by suicide. And for those for 35 to 54, 18%. So that's a really high suicide rate for deaths among 15 to 34-year-olds is 19% by suicide, and that shows the mental toll that low income has in living in those areas. So that shows the need for a more personal approach rather than just policy and environmental change. They need somebody who's there talking to them, letting them know, hearing their problems, hearing their issues. Another factor is the environmental aspect. For example, places like food deserts where there maybe isn't access to produce, so there isn't access to a good grocery store that has healthy foods. Instead, there's fast food and convenience stores that don't offer nutritious foods, but rather cheap, easy options that lead to unhealthy habits. And also factors like smoking. Even though there's a public ban on smoking, there's still a huge factor in healthcare in the low-income areas. Poverty is a huge issue nationally, and some of the national interventions that I found when I was doing my research are things like the Social Innovation Fund grant, which is a grant of $85 million over 5 years to several U.S. cities. One of them actually is Kansas City, and the whole goal of that grant is to fund policy changes, new policies to combat poverty. For example, a match savings account for those who have low income when they file taxes. The goal is there's not really a restriction on what they can do with that money, but the goal is to find whichever city finds a working solution, so they don't set a limit. You have to use the money for this. You have to do this kind of intervention. They give the money over the 5 years and let the city decide what they think is best, and then use that data to decide which method might be the best at attacking poverty and attacking the low-income areas. As far as like food, there's a supplemental. The USDA has the Supplemental Nutritional Assistance Program, which assists low-income families with offering them discounts on healthier food so that they can afford to eat healthier, even though healthier food typically means more expensive than the non-healthy stuff. So this allows those families to get that access to that produce, that food that they did not have before. Poverty has been a huge issue nationally, and so there was over 265,000 people in Kansas City last year who did not have health insurance, and those who are uninsured obviously do not have access to proper health care, and that affects their health. And that ties back into the low job opportunities. They're not able to seek work and get good high-paying jobs or get good jobs that offer health care, and so they're often suffering the consequences of that. And that's not going to be changed with a policy or changing up the environment. That's not really going to affect their health. So in Kansas City, to combat poverty, as far as the environmental approach, there's the Green Impact Zone, which it was a stimulus-based program that's whole goal is to revive 150 square block area of Kansas City by just redoing buildings, filling vacant lots, just to kind of spruce up the area to entice more people to move in and to encourage outdoor living, and people just kind of like reviving the area. And on the policy side of things, there was the mayor's, what's called the Mayor's New Tools Task Force, and their whole goal is to enact, is to affect poverty and lower the poverty rates via policy, so making policy changes. And both of these are more long-term options, and they don't really help those who seek help now. It's not really an immediate solution. While they do have good goals in mind, they have seen results, it's more often with a longer term mindset, and that doesn't really help those who kind of need help now. Like for example, the environmental change, like sprucing up a neighborhood, it's not going to help a kid who needs food now or a kid who needs school now, but it is going to help those in the future, which is good. My proposed solutions are more immediate based. For example, my first solution was preventative care. I think that's the most important, is treating these issues, treating the things that are affecting people's health before they happen, is preventing instead of treating and coping with. I think that's a huge thing. If we can treat and showcase healthy living habits and eating habits, then you can avoid several illnesses and ultimately um, raise the quality of life in these low-income areas. It's also an immediate solution rather than a long-term, and uh, it helps with those who are struggling to just get by currently. Another issue that has a huge effect on health, especially in Kansas City, is the lack of compliance when using medication, and that kind of ties into my second solution is using the school nurse. So the school nurse sees all the children in the area, is there every day. She's in the school with them. She's a person who's there to talk to them, ask them about their problems, what they're struggling with, like what's going on at home, and they can kind of bridge that barrier between home and doctors. And oftentimes, families feel more comfortable talking with the school nurse, especially if there's a language barrier. School nurses can help the parents understand how to take the medication, can help make sure the child is taking the medication during the day. It can reach those kids that aren't maybe not in the green impact zone or not affected by this policy, and it's more of a now solution rather than a long-term solution. And it helps the parents feel more comfortable sending their kids to school because they know they're going to get good attention when they're sick, or if they have issues, they can kind of catch them before the symptoms set in. And that also ties into my last point, which is the screening that the school nurses provide, which is very vital to that preventative care. If you can catch certain factors before they happen, then you can ultimately raise the quality of life and have less non-healthy people and kind of attack those health issues. So all in all, the poverty in healthcare is there's a huge causal relationship between the two. Your socioeconomic status is a direct determinant of your health. So if you can help those who have a low income with their health habits, then they can then reverse their low income, maybe seek work and find jobs that pay and offer healthcare coverage, and vice versa. If you help someone financially, they're able to possibly get their health back on track. Thank you for listening.